My name's Jason Schuster. I'm a doctor of physical therapy. I own Intricate Art Spine and Body Solutions. It's a continuing education company teaching other doctors how to do a couple things. Before that, I was a fly fishing guide in Patagonia, Chile, and southwestern Alaska for a decade. This is a clip from our online Dry Needling 2 class, Dry Needling to Improve Men's and Women's Pelvic Health. This is a great class. Check it out on our website, intricateartseminars.com, to get the full 10 CEU fully online class. Pelvic health and scar tissue. Treating scar tissue anywhere in the body is super important to do with needles because scar tissue is technically being made primarily through the autonomic nervous system, and it really disrupts the autonomic nervous system if it's not treated properly as it's forming and after it forms. So scar tissue, untreated scar tissue, is like, I think the best way to think about it is like a direct little buzzing, nagging, stinging aggravation to the autonomic nervous system, which is stimulating the sympathetic side of the autonomic nervous system. So aside from the negative nervous system effects, scar tissue, obviously, if it's untreated, even if it seems like it's relatively mobile on the surface, what you find when you stick needles into scars is that nice feeling scars on the surface, right when you get down like half a centimeter or a centimeter, you just run into a brick wall of tissue. That is very detrimental on mechanical function, obviously, and even if they're not consciously bothersome to people, if scars have not been treated, they need to be treated because you can never maximally regulate the autonomic nervous system without treating the scar, right? So regardless of the mechanism of injury, why the scar is there, how old it is, it's very helpful to treat scars, and it's necessary if you want to maximally regulate the autonomic nervous system. As far as scar tissue goes, one of the things that our body has a tendency to do just from evolutionary learning is it overreacts to stuff. So even though we're not in immediate danger, typically like after we get hurt or obviously after we get a surgery, we're in the hospital, our body tends to, on certain people it does more than others, it overreacts. So when the body overreacts and it's forming and it's healing, overreaction is excessive fibroblastic proliferation, too much collagen deposition, and you get runaway scars like keloid scars or abnormal scar tissue formation. One of the best ways to inhibit abnormal scar tissue formation and to maximize our lizard healing, you guys. So we do have a certain percentage of lizard healing abilities where we can actually regenerate, like true healing. And then we have scar tissue healing or like glue healing. We want to minimize our glue healing and maximize our lizard healing or our true regenerative abilities. And one of the best ways that we can do that as far as needling treatment goes is needle around newly healing scars to reduce tension on newly healing scars and maximize blood flow and nutrients and vitamins and minerals that are going to the scar tissue, which needling does both, right? So needling reduces muscle tension. The more stress that's placed on healing scars, the more it stimulates collagen to be deposited by excessive fibroblastic proliferation and collagen deposition. So it's important to normalize and reduce tension on healing scars as much as you can. This is how plastic surgeons are trained to minimize scar tissue visibility after they do things like rhinoplasties or facelifts, breast augmentations, breast reductions, all that stuff. And we want to be needling scars day one after surgery. The sooner you get to needling around newly formed scar tissue, the better off the surgery heals, the better off the scar looks, the better the scar heals, the better off everybody is. And needling is anti-infectious, you guys, and I will talk about that in a few minutes here. So needling induces immune cell infiltration into healing tissues. One of the reasons why needling is anti-infectious, although most surgeons will ask you and they think that it increases the risk of infection. It does not. It decreases the risk of infection. Does pushing a foreign object into the body have to somewhat increase the risk of infection on its own? Yes. But this is surgical stainless steel. No doctor would ever tell a diabetic patient not to take their insulin shots after they had a surgery, so that's just ridiculous. And everything else about the needle is anti-infectious. So the needle's not taking a skin plug. It's not pushing skin into the body. Everything downstream of the needling is anti-infectious. It decreases sympathetic hyperactivity, which improves immune function. It sends white blood cells to the area. It helps macrophages gobble up infectious material. It helps the body respond to foreign pathology and everything else. So everything that needling does is anti-infectious. A more homeostatic autonomic nervous system is anti-infectious. All science says that. So there's no reason to believe that needling is anything else, right, you guys? So needling reduces pro-inflammatory markers. It increases anti-inflammatory pathways. It improves vitamins and minerals and nutrients and white blood cells and all that stuff that are going to the area. It just helps things heal better, faster, more completely. This is really cool. So this is from a study on the bottom of this page, you guys. And this is an important thing to think about. For some reason, people think about scar tissue as dead tissue. Scar tissue is not dead tissue, though. Like, our living tissues are depositing the collagen to help our body heal itself, right, in normal circumstances. Collagen is the most abundant protein in the human body. So scar tissue is not dead tissue, although it's thought about as dead tissue. It plays a role in metabolism, you guys. It plays a role in the fact that as far as we understand, there's a lot less energy production going on inside scar tissue because it doesn't have as many mitochondria as regular like muscle tissue. So that dysregulates metabolism. It has its own metabolism. It's different than regular skeletal muscle tissue metabolism. So scar tissue is living tissue, and this is an article from Heart Cells. So one of the or from a heart study. So one of the things that we know that happens, you guys, is the inside of the heart will form these like ectopic foci, or they're like little pieces of scarred heart that you see happening in way more people than should be happening nowadays. Like random heart inflammation and heart damage, and the cause of that is obvious, but we won't get into that. And what happens is the actual scar tissue starts like becoming its own little pacemaker, and it starts sending the heart when they activate into abnormal rhythms. So that's one of the things they do when they put catheters up the femoral vein, and they go in and they ablaze like the inside of the heart. They zap the heart and they try to zap out those little abnormal scar tissue formations, although that's obviously making more scar tissue. Sometimes it works though, and it stops the abnormal the electrophysiologic function of the heart. So that is scar tissue specifically forming its own like electricity. And even though that may not be happening specifically the same way in the rest of the body, scar tissue is not dead tissue, guys. It's living tissue, and it needs to be addressed as such. I included this picture. This is from that heart scar tissue study, you guys. So this is one of the reasons why damage to your heart inflammation causes heart scar tissue, which is extremely detrimental for the rest of your life, because if you just look at the red is like the red in this picture, you guys, is the scar tissue, and the arrows is electricity. So if you just think about, just really simplify this, electricity is going towards the scar tissue in one direction, and then because the scar tissue is a different density and different makeup of regular heart tissue, that sends the electricity, like it curves or it kinks the electrical current the way it's going, and it sends the electricity in a different pattern, which causes the heart muscle to start doing weird things. And that is like the different types of electrical dysfunction, disruptions that scar tissue within the heart causes. And that's basically exactly the same thing that scar tissue is doing in skeletal muscle tissue. It's just not causing as obvious and like severe of a problem where like heart attacks kill you. Muscle cramps are not going to kill you if they're not in your heart. But that's basically what's happening, is like this abnormal electrical gradient is the electrical smoothness or the electrical flow is getting disrupted by this denser abnormal scar tissue, which is pushing the electricity in this weird pattern. That's disrupting the normal pattern, and it's causing problems. Same exact stuff happens in other tissues. It's just not as like life-threateningly severe. Here's just a little box from a cell metabolism paper, you guys, from 2021, just about like typical characteristics of tissue damage, right? So damaged organ tissue, got abnormal tissue architecture, resident recruited cell types are going into the area, abnormal DNA, transcription, translation, regenerative capacity gets disrupted. Then you have all sorts of different causes, the wound environment, and systemic factors. We don't need to get into all that, but just take it that all of these things get disrupted from a dysregulated autonomic nervous system, and they all get better as the autonomic nervous system gets more homeostatic. And here is a good model. This, you guys, was from a wound healing study looking at model of cellular metabolism, anabolic and catabolic cell functions of the wound healing response. I'm not going to go into this with you guys, but I included this because this is just a little bit more neurophysiology. The paper that it's from is down there, looking at just like the angiogenesis phase, myofibroblasts, anti-inflammatory, all that stuff. For people that are interested in the neurophysiology, which I really am, that is a good paper. But just overall, you guys, needling around newly formed scars or healing tissues while also targeting the parasympathetic part of the autonomic nervous system and targeting any other tissue pathology in the body, all those things are going to push the autonomic nervous system towards more homeostasis, which is going to lead to better overall tissue healing, better scar tissue, and just better all health in general, both mental and physical. Just a couple of tips, the way that I needle, and there's lots of different ways to do this, and just a couple of things that typically happen, you guys. So if the scar is not keloided, needling basically guarantees the fact that you can take it from being indented or elevated and flatten it out and change it if it's off color. Needling the scar itself and around the scar and regulating the nervous system in that area will change the scar tissue back to as normal skin color as we can get it without any other types of technological techniques like laser something. Sometimes it makes it totally invisible. It makes a huge difference, you guys, on off-colored scars. So it'll flatten them out, whether they're indented or elevated, and it'll turn them back towards skin color. I treat scar tissue just like any other tissue in the body. If it's over an area that I can safely needle down to the bone, eventually I want to be able to stick a needle right through the whole scar tissue. When you first start needling a new scar, you're not going to be able to get a needle all the way through it. Don't needle the healing, the scar itself until the scab's fallen off and it's visibly healed, you guys. But I like to needle right up to and around the scar, which helps the tissue heal faster. It helps the scab fall off faster and helps the whole thing heal faster. So I needle right around the scar day one, and I'll needle the scar tissue itself immediately as soon as I see that it's visibly healed, and that just helps the whole thing heal faster. Scars adhere to the periosteum, which becomes a big problem. This is especially true, you guys, in like knee scars, spine scars, scars that are closer to the bone anyways, and that cut's going all the way through, obviously. Needling, you can needle right down through the scar to the periosteal scar attachment. This really helps normalize the whole scar tissue. And then remember, by twisting the needle, we're taking crinkled up collagen fibers and we're straightening them out. So straight parallel collagen fibers are the strongest, healthiest ways for collagen fibers to be, and they are the best as far as just overall function goes. And this is from an acupuncture study, you guys, looking at animal studies and what's going on with the pro-inflammatory markers, interleukins, some of the reactive oxygen species, nitrous oxide pathways. So I'm not going to go through this, but I like to include this because this is a good diagram specifically on an acupuncture study looking at some of the specific ways that acupuncture helps wound healing through changing the brain, regulating DNA expression, regulating the amount of pro-inflammatory and anti-inflammatory markers that are going on, interleukins and different proteins, turning on anti-inflammatory pathways, and just overall helping improve autonomic nervous system homeostasis, which helps improve wound healing. Thanks for watching, you guys. If you like this clip, Keep an eye on my channel. I'm going to keep putting clips from both of our online dry needling classes. This was a clip from our online dry needling 2 class, Dry Needling to Improve Men's and Women's Pelvic Health. Check it out on our website, intricateartseminars.com, or check out our school channel, school.com/CEU, SKOOL.com/CEU, to get a big discount on our dry needling bundle. It's a bundle of both of our online dry needling classes for a big discount.